Good evening, ladies and gentlemen. My presentation is about heart block or athlete's heart or conduction abnormalities. This presentation is more specifically talking about athletes and younger athletes, and we have a little bit of EKG background right here. The EKG or electrocardiogram reading will help us in the diagnosis of this disorder. Now, as we go through the next slide, I have the outline prepared for you to see as far as the conduction abnormalities, causes and risk factors, signs and symptoms, diagnosis, heart block, and athletic performance. As I mentioned earlier, it is for younger athletes. Medication and treatment for this disorder, rehabilitation guidelines, physiological responses as it happens when this disorder takes place, exercise guidelines which are important for recovery. We're going to look at the recent article and also 2 research journals and a little bit of summary and then citation. Now as we go through the next slide, I'd like to speak a little bit about what the pathophysiology is behind the conduction abnormalities. Is the disorder that takes place in the electrical system of the cardiac muscle or the heart muscle. Heart muscle is a pump. It does take electrical activity in order for the pump to take place to be able to help circulation. Blockage can happen. This blockage or the misrhythm of the electrical conductivity can happen at any level of the conduction system of the cardiac muscle, which we're going to speak a little bit more in details. As you can see here, these are the different types of the pathway of the electrical conduction system. The SA node or the natural pacemaker of the heart. You have the AV node, right bundle branch, left bundle branch, Purkinje fiber, bundle of His, or the atrial tracts that exist in the cardiac muscle. As we go through the next slide, I would like to take your attention into a picture of the heart, and this picture will basically give you the breakdown of what's going on along the cardiac muscle for the electrical impulses that take place and cause either a heart failure or the athlete's heart. That's another name for it. The SA node is where the original firing happens for the electrical impulse. You also have the AV node or atrioventricular node is right there in the middle between, if you basically cut heart in 4 pieces between the right, left, superior and inferior, AV node should be around the middle. You do have the atrial tract, which kind of comes off of the sinoatrial node. You have the bundle of His, left bundle branch, right bundle branch, and the Purkinje fiber at the inferior section of the heart. Now, these are the sites where the blockage happens for the heart block. The sinoatrial node is the main part of the blockage, the AV node, bundle of His, and sometimes the blockage usually happens in left bundle branch and right bundle branch of the heart. Now as we go through the next slide, we're going to talk a little bit more specific about the classification of the heart blocks. The first one is the first degree heart block. These are the different types of it. First degree doesn't necessarily have a treatment. The second degree might need a pacemaker, but it depends of the level. It does break down into Mobitz type 1, Mobitz type 2, and you do have the third degree, which is the complete heart block, and it is an emergency case at that point, and it does need a pacemaker. Now, as we go through the next slide, We're going to talk a little bit about the causes and the risk factors. The genetic factor, which is congenital. You have the heart attack sometimes leads to HR block. You do have the inflammation of the cardiac muscles in some cases. Blood circulation is poor because of the misrhythmic of the conduction of the cardiac muscle. Toxic substances cause the athlete's heart. You have certain medications that could cause that, include digitalis, beta blockers, and calcium channel blockers. Mostly calcium channel blocker is the cause of it. Obviously age, as you get older, gender between male and females, diet and lifestyle, of course, has a huge impact. And as we go through the next slide, I'm going to talk a little bit more about the signs and symptoms of the athlete's heart. Usually it comes with the chest pain, you have the dizziness, lightheadedness, fatigue or extreme tiredness of the body, shortness of breath, and fainting in some cases. And if you see any of these signs and symptoms, what you want to do is you want to call 911 right away. Of course it follows with proper instructions of CPR or defibrillator. So you do have the diagnosis of HR block or heart block. It goes through exercise stress testing, which can be diagnosed through electrodes that are placed on your body, and you get the electrocardiogram reading, and via electrocardiogram you can tell which site or what location has the blockage. Thank God we do have the ability of diagnosing through that testing to be able to prevent that from any further issues. Signs and symptoms are usually reviewed by physicians to monitor for any heart rate, heart failure, or any heart problems. They do check for health backgrounds to find out if there was any surgery done, any other health issues that could relate to athlete's heart. Medication history, medication intake is very important because, as we mentioned earlier, there are certain medication that cause the athlete's heart. Lifestyle, family history is monitored by physicians. Smoking, alcohol, and drugs can have a huge impact on diagnosis of heart block. Now, when we're going through the presentation, I would like to talk a little bit of what the stats are as heart block affects athletes. First degree or AV block happens in 1/3 of athletes, which is a high percentage. Second degree happens during rest and disappears with exercise, which I found interesting. Left ventricle hypertrophy is common in athletes, which usually leads to athlete's heart. Deep T wave inversion in electrocardiogram reading could lead to that. Incomplete right bundle branch blockage, that's another site for blockage of the heart and causes the conduction abnormalities. Now, as we go through the medication and treatments, the first degree heart block, as I said earlier, no need of treatment, but they will monitor lifestyle, nutrition, exercise for that mostly. Second degree needs a pacemaker for the most part. Third degree, definitely, as I mentioned earlier, it is a emergency case. Medications, once the athlete is hospitalized, they would basically connect them with the IV fluids, calcium, glycogen, glucagon, and vasopressors and high dose insulin would be helpful. Now, there are different type of rehabilitation programs and recovery that athlete needs to go through with this. Rehabilitation guidelines, phase 1, phase 2, phase 3, they broke it down into 3 different phases for the recovery section of it. You do get hospitalized for phase 1. There is very low intensity exercise and maintaining the mobility of the body. Phase 2, cardiac rehab center is necessary, improving functional capacity of the heart or lungs. ECG monitoring, physical therapist comes to count. BP, blood pressure, heart rate, and cardiac rhythm is monitored daily, which is really important. Aerobic exercises, a little bit of treadmill or stationary bikes in specific. When you get to phase 3 is basically outpatient setting and supervised strength training and cardiovascular activities is properly monitored. So as we go through the next slide, we talk about the physiological changes a little bit. Thickness of the heart chambers in some cases is high. Rhythm of the electrical impulses. The reason why I put that down is because the electrical impulses don't transfer properly, so there's a decrease in performance as far as electrical conduction. Blood circulation is low, blood pressure in some cases is high, dizziness and pain, as we mentioned earlier, it is high as far as signs and symptoms. So as we go through exercise guidelines, strength training is critical, cardiovascular is critical. They will go through goals of the patients, duration, frequency of the exercise. Very low intensity exercises happen for this type of disorder. Warm up and cool down, of course, is important. Duration is very low. Frequency, depending on how much the patient can handle, that will vary. So the first case was Wes and Nick. They were both 16 years old, and Nick died in sleep after playing the game. Wes was 16 years old. That case was in Holland. He actually died on the basketball court during the game after making the winning shot. And cases like this, if there was a pacemaker active in their chest, they could have been with us today. Exercise stress testing is very critical, and that was the main part of the article that I was looking at to set it up. There's a $5 million project, as they mentioned in this article, which was funded by a private grant, to test 10,000 students, and they said if we could only have one student survive out of that 10,000, it is still worth it. So as you see, exercise stress testing becomes very important for diagnosis of athlete's heart. As we go through the research aspect of it, they look at 6 cases of congenital complete heart block, which they followed these patients for 30 to 40 years by monitoring them, their heart rate, blood pressure, heart size, and case number 4 along these years experienced a few heart attacks, and he was the only one who could not improve as far as recovery goes. Case number 5 experienced hypertension, but everyone else in this research pretty much improved on lifestyle and continued with daily activities with no problem. Effects of multicellular biventricular pacing in patients with heart failure and intraventricular conduction delay. The sample size for this research was 67 patients. They put pacemakers in them. This study was single-blind, randomized controlled crossover study. Primarily, they did a 6-minute walk on the treadmill. Secondary, they measured the quality of life by a questionnaire, and they wanted to measure oxygen consumption. The result was that 9 patients withdrawn, 10 failed to complete both study periods, 48 patients completed both studies. Statistics was that the mean distance walked in 6 minutes was greater in 23% by 23%. Active pacing, the quality of life score improved by 23%. Peak oxygen uptake improved by 8%. Hospitalization was decreased by 2/3. Active pacing was prepared by 85% of the patients, which is a high number for using a pacemaker. So as you see, the rehabilitation part is very important in recovering properly for the athlete's heart. Summary is that yes, there has to be a mandatory exercise stress testing because the electrocardiogram reading can help us with detecting this disease or disorder. And as you see, exercise rehab guidelines, nutrition and supplementation, consultation, lifestyle monitoring, medication is really important. And of course, we want to say no to drugs, toxic substances, and alcohol to prevent further issues for heart block. And these are the references, and thank you very much for listening.